tonight. Jamaica yesterday recorded 147 new cases of COVID-19 and 9 new patient deaths, 6 classified as COVID-19 related and 3 under investigation. Health and Wellness Minister Dr. Christopher Tufton, during today's press conference, says the hospitalization from COVID-19 has become alarmingly high as the country is now in the red zone.
A portion of these active cases would require monitoring in hospital, and so a rise in hospitalization of COVID-19 cases or patients is a reality, and it is adding to the burden on an already overburdened infrastructure.
Leader of the opposition Mark Golding, during today's People's National Party media conference on the COVID-19 pandemic and other national issues at his office, says the country is now in a health crisis because of poor management of the pandemic by the government.
Jamaica is now in a full-blown health crisis. Our situation has become much worse than our Caribbean neighbors. This has arisen because of poor management of the pandemic.
And attorneys in St. James are calling on the relevant authorities to make provision for bail hearings to be held as their clients are being detained in lockup for a long period of time.
They should make suitable arrangements as they do in cases before the Gun Court and the High Court for us to hold these bail applications by video or virtual.
Good evening. Jamaica yesterday recorded 147 new cases of COVID-19 and 9 new patient deaths, 6 classified as COVID-related and 3 under investigation. This brings the total number of confirmed cases to 21,826, of which 8,163 are active, and the confirmed COVID-19 death toll now at 405. According to the Ministry of Health and Wellness, the latest deaths consist of an 88-year-old female from St. Elizabeth, a 67-year-old female from St. Anne, a 63-year-old male from St. James, an 81-year-old male from Trelawney, a 73-year-old male from Kingston and St. Andrew, and a 63-year-old male from Trelawney, whose death was previously under investigation. The ministry also reported another death as coincidental. Meanwhile, of the newly reported cases, there were 60 males and 87 females with ages ranging from 9 to 87 years. The cases were recorded in Kingston and St. Andrew 36 cases, Manchester 22, Trelawney 18, St. Anne 17, St. Elizabeth 16, Clarendon 11, St. Thomas 11, St. James 10, St. Catherine 3, St. Mary 2, and Hanover 1. The country also recorded 58 recoveries yesterday, bringing the total since the outbreak locally to 13,046. Due to the spike in COVID-19 cases and the limited number of beds, the University Hospital of the West Indies, UHWI, is asking the public, private medical practitioners and hospitals referring patients there to kindly make contact ahead of time or prior to transfers. In a statement yesterday, the University Hospital of the West Indies says that contact can be made by these 2 cellular numbers, 876-541-1043 or 876-541-1044. The University Hospital continues to fulfill its mandate to provide the highest level of care for all patients, while at the same time ensuring the patient's safety is given full consideration, it says. Health and Wellness Minister Dr. Christopher Tufton, during today's press conference, says the hospitalization from COVID-19 has become alarmingly high as the country is now in the red zone.
The increase in the number of COVID-19 cases in the country remains a cause for concern. The increase means more active cases require management by the health team, which means more stress on the health infrastructure and on the health team. A portion of these active cases would require monitoring in hospital, and so a rise in hospitalization of COVID-19 cases or patients is a reality, and it is adding to the burden on an already overburdened infrastructure and clinical team. In the last week, the country added some 2,818 new COVID-19 cases and saw hospitalizations move from 245 to 270 patients positive for COVID-19. And I just pause to say here, there's a direct relationship, and this is borne out by an assessment of the data, a direct relationship between the number of cases that are reported as positive cases and the number of hospitalizations, or the increase in hospitalization.
Dr. Tufton also outlined the level of hospitalizations across the country.
We have currently some 13 of 22 hospitals across the island at the red alert phase, which means that they have a greater than 84% occupancy level for its isolation capacity. 9 of these hospitals are at 100% or greater capacity. The current hospital census shows that Cornwall Regional Hospital, Falmouth Hospital, Anata Bay, Port Maria, Mandeville Regional, Maypen, Kingston Public, Princess Margaret, and Spanish Town hospitals all exceed their capacity to house patients who require isolated care. And this, of course, has to be worrying, not just for public health, but for the entire country. All 4 regional health authorities have 2 or more hospitals in the red alert zone. The Western Regional Health Authority has 3 or 4 hospitals in the red zone and 1 in the amber zone. NERA has 3 or 4 hospitals in the red zone. SERA, or Southern Health Regional Authority, has 2 or 5 hospitals in the red zone, and the Southeast Regional Health Authority has 5 of 9 hospitals in the red zone. So the conclusion, therefore, is that the country is facing a serious challenge as it relates to availability of hospital space due to the increase in cases.
The Health and Wellness Minister also outlined the policy responses to the increase in COVID-19 related hospitalization.
So as a ministry, we have consulted with our team on the ground and have put the following plans in place to address the increased hospitalization and the demand for general care at the public health system. First is to look at how we can increase the bed count. So in addition to the field hospital spaces, which are yet to be deployed, but very close to being deployed, and I visited the 2 last week, Falmouth and St. Joseph's Hospital sites, and they are pretty much complete and are now being prepared in terms of the internal infrastructure and staffing. In addition to those, totaling some 72 beds, we're adding an additional 20 beds at the National Chest Hospital, and I visited the National Chest Hospital yesterday. Their COVID ward was 100% taken up, 36 beds. They are now adding additional 20 beds, and we're providing for them some additional infrastructure to support that. As well as at the University Hospital of the West Indies, where I again visited yesterday, they are converting an existing ward for general usage, which contains some 25 beds, to being an additional COVID ward. The 40-bed field hospital that was originally sited at the National Chest Hospital is being moved to Spanish Town, and I believe we had made that public earlier, so that again will add some additional capacity. The Ministry of Health and Wellness had initiated an arrangement with the Andrews Memorial Hospital. This is an additional possibility that will come on stream for the accommodation of overflow of non-COVID patients. So it's not a COVID hospital.
He says there is some amount of uncertainty in the marketplace, and the certainty of a date when the country will receive vaccines is difficult to give at this point.
Words like vaccines, nationalism, and vaccine diplomacy and all of that is creating some amount of uncertainty in the marketplace. Even for those countries that have large sums, they commit to purchasing, but there's no vaccines to purchase. And so Jamaica is not immune to that. And indeed, all the countries of the Caribbean are suffering from that, and particularly smaller countries. So we have that commitment. It's a commitment for over a year period. Initially, very importantly, that commitment was to have begun in April, and we were all planning for the April date. But then we're told that it was moved forward to February, which we were very elated about, happy about, and we spoke to that publicly based on that correspondence that we received. Now the uncertainty is still there because we haven't seen any vaccines during that period of time. Again, I'll wait until we get confirmation of the shipment before I venture to give specific dates. So that's one area which we think will happen. The question is the timing, and we are preparing for it. The other avenues are many. Working with the Ministry of Foreign Affairs and Foreign Trade, working with the private sector organization of Jamaica. There are a number of initiatives that are being pursued involving bilateral partners, a number of countries who have developed and are producing vaccines.
In other news, leader of the opposition, Mark Golding, during today's People's National Party media conference on the COVID-19 pandemic and other national issues at his office, says the country is now in a health crisis because of poor management of the pandemic by the government.
Jamaica is now in a full-blown health crisis. Our situation has become much worse than our Caribbean neighbors. This has arisen because of poor management of the pandemic. The first major spike in cases began last August and was worsened by the calling of a general election in the middle of that spike. And it is noteworthy that the health authorities announced the advent of community spread in Jamaica the day after the general election. Then, over the Christmas period, we witnessed the usual heavy influx of returning Jamaicans for the holidays. The quarantine rules were ignored by many, and there was no effective enforcement of those rules. And when they left Jamaica after the holidays, a lot of COVID infection was left here behind. In the 2.5 weeks, or 18 days since February the 4th, we have seen a massive increase in infections, approximately over 5,000 new cases of COVID. The hospitals in the country are either full or very close to being full. We have heard today that the Medical Association of Jamaica is saying that the situation is so bad that a full lockdown of the country may be necessary.
The opposition leader says he is calling on Prime Minister Andrew Holness to establish a vaccination task force headed by him to ensure the procurement of COVID-19 vaccines for the country.
As the crisis worsens, we hear less and less from the Prime Minister. In the earlier stages of the pandemic last year, he held lengthy press conferences on a daily basis. Now, we hardly hear from him as the crisis unfolds. He seems to be in hiding. Given that the situation has been allowed to get out of control here in Jamaica, it makes it all the more critical that we vaccinate our population as quickly as possible. That is the only way that we can recover as a country and get out of this crisis. The Minister of Health established a vaccine commission last year. Despite our request to be part of this, the opposition has been excluded from it. But it turns out that they were doing nothing to try to source vaccines for the country. The government instead put all its eggs in one basket, which is the COVAX facility, which the World Health Organization has been organizing. I am calling on the Prime Minister to establish a high-level task force headed by the Prime Minister himself to take charge of the procurement of vaccines for the country. A competent CEO must be appointed as the czar to run the day-to-day operations of sourcing the vaccine on a full-time basis. There should be weekly reports to the nation of the efforts and progress being made to do this. The approach currently being pursued, which appears haphazard, ad hoc, and not transparent, must end. The opposition is willing and able to join in this effort.
And opposition spokesperson on health and wellness, Dr. Maurice Guy, says the uncertainty surrounding the vaccination plan has become a national embarrassment.
The Minister of Health promised the country that we'll have a rollout in the country by the middle of February, and that vaccinations for persons would begin much earlier than the previously announced time of mid-March. But we are in the fourth week of February now, and there has been no indication as to when these vaccines will arrive and when vaccination will begin. It, ladies and gentlemen, has become a national embarrassment. As a matter of fact, Jamaica is seemingly the last Caribbean country to receive vaccines and begin the vaccination of our people. In fact, I was advised this morning that it's only Jamaica and Haiti which have not started a program so far. In our estimation, as the party leader said, the government was late and tardy in accessing vaccines and was initially totally reliant on procuring the 16% that would have come through the COVAX facility. We feel that with the fluidity of the vaccine production, with the fact that the World Health Organization is going to approve more vaccines and the greater rollout by manufacturers, that the government ought to hold off on Moderna just now and spend that money on other areas critical to the furtherance of the health sector.
Dr. Guy further pointed out flaws in the government's vaccination budget.
There's another document that came out from the Ministry of Health, and I want to bring it to the attention of the Jamaican people. The budget for the vaccine program, despite the minister saying that the $422 million is not for PR, they've given us another iteration of that program. And it speaks of procuring vaccines, procuring syringes, 3.585676 syringes to administer for the vaccination program. And the government is budgeting 55 US cents per syringe. That works out to 87 Jamaican dollars per syringe. I made calls this morning because when I saw that, I realized that I was flabbergasted. Syringes, which are 3 cc syringes, which are bigger than what is required for vaccination, cost $13 per syringe. Those that you need for vaccine are cheaper. So we'd like to know how the government got this 55 US cents or 87 Jamaican dollars per syringe for the vaccination program. And we urge, as all Jamaicans do, to have the government look at this again. Because as a country, we can ill afford this. This is squandering of the people's money in this country by this government.
Minister of Education, Youth and Information Favour Williams today confirmed that teachers and other persons essential to the operations of schools will be included as a priority group for COVID-19 vaccination. She revealed that, quote, "To coordinate this important development, we began talks today with the Ministry of Health and Wellness regarding a schedule of vaccination for this priority group against the COVID-19 virus," end quote. She has also updated the Jamaica Teachers Association, and there will be further discussions over the next few days to look at the options and criteria for prioritization among the various personnel in the system. And as the COVID-19 cases continue to rise in the parish of St. James, with inmates at the Montego Bay Freeport Police Station a part of that number, some lawyers in the parish are calling on the relevant authorities to make provision for bail hearings to be held as their clients are being detained in lockup for a long period of time. Attorney at law Clayton Morgan, in speaking with our news team earlier today, explained that his client, along with other inmates at the station in Freeport, are awaiting bail application.
The issue that I'm having is that I have a client who is incarcerated at the Montego Bay Freeport Police Station. He has been in the custody of the police since December last year. He's a U.S. citizen and American tourist. Was on a visit. He was arrested on a charge of rape. He was incarcerated at Barnett Street for a few weeks before being moved recently to the Montego Bay Freeport Station. I have made several court appearances on his behalf, applying for bail. The applications have been refused on grounds that have been put forward by the clerk of the courts. The problem is that he's not alone. There are several inmates at the Montego Freeport Station awaiting bail applications. Mark you, I didn't say awaiting sentencing after convictions. Awaiting bail applications. They have not been brought before the court. Not because of the fault of the courts, but because the Ministry of Health has placed a quarantine over the Montego Bay Police Station, Freeport Station, under the Risk Management Act and protocols thereunder. There are only a few cases of COVID-19 at the Montego Freeport Station, I'm told. The inmates who are infected, I understand they are isolated from the others. Why can't the ones who are not infected be brought before the court, or for us to have bail applications heard on their behalf? If bail is granted, it will reduce the population of inmates at that facility.
Mr. Morgan pointed out that despite the COVID-19 protocols put in place by the government, it is in breach of the prisoner's constitutional right to have him or her indefinitely in custody, and they are not brought before a judge for a bail application to be heard.
The police state that they are unable to bring these inmates before the court because of the quarantine and because of logistical problems. There's only one police vehicle, a truck that is available to shuttle the prisoners to and fro from the station. Because of the protocols, it's impossible for the police to obey the protocols of social distancing. And they say it's risky to bring them to the court, to place them in the holding area downstairs, to bring them upstairs before the judge, to take them back to the holding area, and then to take them back to the station. They have to obey the protocols. Now, we are saying that it is a breach of the constitutional rights of a person to have him indefinitely in custody without being brought before a judge for a bail application to be made. I am not saying that bail should be granted, I am saying that it is incumbent on the authorities, on the Ministry of Justice and on the Ministry of National Security in particular, to see to it that these prisoners who are in custody awaiting bail applications be brought before a judge. Now, I am also saying that if it is difficult for the authorities to bring these inmates before the court because of the COVID-19 restrictions, then they should make suitable arrangements, as they do in cases before the gun court and the high court, for us to hold these bail applications by video or virtual.
Another attorney, Shelley-Ann Hyman, expressed that it is heartbreaking the conditions her clients have to exist under while awaiting bail.
One of the concerns that we have is that this is a jail. It is not a prison. You have persons in custody who will never be convicted of an offense. And even if they were convicted of an offense, they are human beings. The role of a defense attorney is not only to ensure that the rights of the clients are cared for, looked after in court, but outside of court as well. If they're on bail, if they're on custody, or even at home. And it is heartbreaking, the conditions that our clients have to exist under. And in the interest of justice, there are things that can be put in place to facilitate a smooth transfer, not only from RM court to circuit court, but from circuit court to prison, to on the road.
Sorry.
The courtroom system that now exists will not work. There can be things put in place, such as retrofitting the courtroom to allow for trials. We cannot force our clients to have a judge alone trial. Everybody has to make a decision, but we should give them options. Also, it is necessary for us to be able to communicate with our clients. There has to be something put in place for us to get proper and clear instructions. These are persons who are human beings, just like us. Anybody can go to jail. Anybody can go to prison. And we have to be mindful of that fact, that when persons are there, they have to be treated as a human being should be treated.
Ms. Hyman further pointed out that as jury trials are set to resume in April, measures need to be implemented that will ensure they can safely return to court.
Now, I understand that jury trials are to resume in April. There are things that have to be put in place for us to be able to safely come to court and be effective counsel. We have seen absolutely no work being done. It is now almost the end of February. And we have to put ourselves in a position to be effective, because everybody wants a good attorney. Now, as it relates to persons in custody at the Montego Bay police station, we call it Freeport, access to proper hygiene products, access to clean clothes, a proper visit from their relatives. That is not happening, and this has been our concern even prior to COVID. So you can imagine now. Now, we're not trying to ask for anything that is outside of the norm. We just want persons in custody to get clean clothing, to get proper food, to get clean water. And that is what any human being is entitled to.
Meanwhile, the leadership of the St. James Division is reporting that prisoners at the Freeport Police Station lockup who were placed in quarantine on Saturday, January 9, were given clearance on February 21 after completing the required quarantine period. The clearance was given by the Ministry of Health and Wellness in an official letter to the division's leadership dated today, February 23. At the beginning of the order, the ministry, through the St. James Health Department, had ordered a cessation of visits to the lockup and advised that movement of prisoners to and from other institutions also cease, according to health officials. The prisoners are now clear to resume normal activities, including attending courts. Still in the news, the police are seeking the public's assistance to locate 19-year-old McKay Williams of Red Hills Road, Kingston 10, who has been missing since February 12. She is about 5 feet 5 inches tall. Reports from the Halfway Tree Police are that Williams was last seen at home and has not been heard from since. Her mode of dress at the time she went missing is unknown. Anyone knowing the whereabouts of McKay Williams is being asked to contact the Halfway Tree Police at 876-926-8184, Police 119 emergency number, or the nearest police station. And those are some of the stories making news. We will return with a few more stories on the government earmarking $320 million for the completion of renovation and construction work at the Public Building West to facilitate expansion of the offices of the Director of Public Prosecution, as well as news that the government is asserting that they will be spending another $1.2 billion in the new fiscal year to continue construction of the Montego Bay Perimeter Road. But first, let's take a break and then join Christopher Scott with sports.